Greetings and welcome to Coffee and Culture. I'm super excited about this conversation that we're having today. Coffee and Culture is meant to not only build great business relationships, but build community relationships where it's important to come together and talk about real issues that impact our community. Today we have a very special guest, as you can see, the beautiful VP of Social Impact and Community Health, Dr. KaSheta Jackson. I'm excited about this conversation because I have never heard of this position before, but ECU Health is covering all grounds, and I'm super excited about it. Dr. Jackson, how are you today?
I'm doing great. How are you doing today?
I'm doing wonderful. Now, for people who have never heard of Dr. Jackson, tell us a little bit about yourself.
Well, first of all, thank you for an opportunity to come and talk about the work that ECU Health is doing.
Yes.
It's exciting to get outside of our four walls and be in our community to talk about ECU Health and our partnerships.
Yes.
So I am KaSheta Jackson. Thank you for the intro of doctor, but I am KaSheta Jackson. I am a mother, I'm a daughter, I'm a wife, I'm a sister, I'm an aunt, I'm an employee of almost 26 years of ECU Health, but I'm also a country girl from Eastern North Carolina by way of Edgecombe County. In my formative years have been here in Pitt County. So I am very fortunate enough that I understand, but also get to learn every day ways that we can improve the health of our communities.
Awesome. Now, speaking of improving health in our communities, your position and you're breaking barriers. Tell us a little bit about, the community health program and what you're doing in social impact.
So our community health program looks at ways that we work with prevention, because we don't want to just start with the cause. We want to prevent the event from occurring.
Yes.
So part of our work is to have conversations just like this with the community to understand some of the things that the community recognizes as issues. Every 3 years, we do a community health needs assessment survey where we listen to the community. We're asking, what do you see as opportunities to improve the health of your local community? We take that information, connect it to our primary, secondary, and tertiary data, which looks at populations of health such as social, economic, and physical. And we put all of that together and we create a implementation strategy. That strategy gives us our guiding or our North Star of where we should start, but it's not a be-all, do-all. One of the things that we learn from that is that health is only about 20% of the overall needs of the community.
Right.
There are things like employment that we need to address, things such as housing we need to address, education we need to address.
Yes.
Our department is responsible, all of our departments are responsible, internal and external, but working alongside our health department to create this assessment is very important.
Oh, yeah, for sure. A lot of people, are dealing with a lot of different issues in our community, and you hit on a few: employment and health issues. And so how are we dealing with, health disparities in our area? What would you say would be some of the things that we can do in that aspect?
Some of the ways that we're dealing with that is, one, we need to call them out.
Yeah.
We need
That's a good point.
We need to understand that health is not just diabetes, hypertension, congestive heart failure, but again, back to those points, is access of care, healthy lifestyles, mental health, maternity, and substance abuse.
Right.
So the way that we address those is, again, we have to make sure that we are showing up.
Yes.
And when I say showing up, I mean we're voting. We are
voting. That is important, great people. Early voting is coming up.
We're voting for candidates that have the best interests for our community so that we can have things that we need, better opportunities for employment, housing, transportation. And one thing that we did learn through COVID is that broadband access is very important.
Oh, yeah.
And then also food and nutrition, that all of those things connect back to improving your health, because diabetes comes from the way that you eat. It can have some genetic issues in there, hypertension, the same thing, but we address it by understanding where the needs are.
Oh, for
and
sure.
then we act.
Definitely acting. And ECU is doing a great job with acting and putting things together in place for the community. Tell us about the community benefit grants that ECU has in place.
So thank you for that question, because
Yes.
it is very important that our community understands that ECU Health is a partner in improving the health and well-being of Eastern North Carolina. And every county that we have a hospital, we have community health benefit grants. And those grants allow for community members to apply for healthcare dollars to go and address some of those priorities, assess access to care, healthy lifestyles, mental health. So those dollars are hopefully, and I know hope isn't a strategy, but hopefully will give better footing and resources. So some of our organizations, and we've partnered today with one, we're delivering food.
Yeah.
That allows for more volunteers to be able to pack up food boxes. One of our other ways is that we are helping organizations get exercise equipment that they may not be able to afford, AEDs. So those grants go back into the community that will, in the long term, improve the overall health of that community that's seeking that grant.
That is a phenomenal thing. I don't know many hospitals that are doing that. That's why ECU Health is leading in innovation for sure, and I'm excited about that. So tell us about, some of the things that people can do to actually, make a better healthcare environment in the community for sure.
So I'm very excited about that question, along with the other questions. But ECU Health, along with our community partners, we are working with Dr. Christina Bowen on the Blue Zone Challenge.
Ooh.
And our team members are able to go through these 9 steps to improve your health, which looks at physical wellness, finding the right tribe, exercising, down, shifting meaning relaxing,
Yeah.
having time to just focus and think. Our goal is to take that information and use it externally with our community partners, our churches, our other civil organizations, and it's called the Power of 9.
Yeah.
Using those steps to just slowly improve your health. There are 5 communities throughout the world that have done this, and these aren't your communities that are that have a lot of finances. These are the communities that are doing things, that are working in their gardens. They're spending time with their friends. They are taking time to just relax. And we've seen that many people in those locations have lived to far beyond 100.
Wow.
So our goal is to do some of those same skills and use some of those same outcomes here to work on improving our community.
Well, I've never heard of the Blue Zone. That's why we need a doctor in the house, so that way you can put us on to information that we didn't know about. Now, of course, Dr. Jackson, as you see, I wrote this children's book called There Ought to Be a Law. And, of course, as a person from the South, you may have heard that a few times where someone is saying, hey, there ought to be a law about that. So, of course, we turned that into a children's book.
Right.
What is one thing that you have found in your profession, and it may not be in your profession, but just in general, that you feel like should be a law if lawmakers are watching today?
So first of all, I do want to acknowledge the beautiful little girl with her curly
This is
curly
Eliza.
hair.
She's in the book.
So that is one and amazing. But growing up, I heard that all the time. There ought to be a law. There ought to be a law about this. One thing that we can say and take pride in is that December the 1st, 600,000 North Carolinians will have access to Medicaid through the Medicaid expansion. And that did not just happen overnight.
No.
That took a lot of advocating from local and state leaders, but also from our leaders of ECU Health,
Yes.
working to say that it is important. The way that we're going to improve the health of our community is that we have to have the dollars to be able to do that. We have to have dollars that are invested to take care of healthcare not only today but tomorrow. Being able to educate our new leaders, educate our community. So I am excited that those dollars will be released and that people will have access to healthcare here in Eastern North Carolina, where it is very needed.
Very much needed, in rural Eastern North Carolina and rural parts of North Carolina in general. Access to healthcare can be a difficult thing. Over the last few months, I've seen, hospitals closing down due to lack of funding and lack of support. So it is a blessing that this budget has, come into a position where it can become law, which is a blessing for sure. But ECU Health is doing some great things also. How is ECU Health making sure patients have better access to healthcare?
So one, thank you for that question. So one thing that we are doing is that telemedicine is very important.
Yes.
ECU Health now is a way for you to see someone. We could see a physician sitting right here at Starbucks.
Yes.
Without having to go to our emergency room for your more acute issues, headache, rash,
Yeah.
even a urinary tract infection.
Really, on telemedicine?
On telemedicine.
Wow.
They will go through symptoms. They
Okay.
will go through symptoms management. But then also My Chart, which that is a way for you to advocate and engage with your healthcare team. You can see your labs, when your test results are up.
Yeah.
You're able to communicate and also ask for prescriptions to be filled or just to speak with your healthcare team.
Right.
Those are ways that we are trying to be proactive in educating our community that one, this service is there and it's available.
Yeah.
You can download the app, or you can even use the phone number, or for ECU Health Now. For My Chart, also the same thing when you're talking with your provider, making sure that you use those tools while you're there so that you can communicate.
Right. Now, of course, your position, of course, is a very important position. You're pretty much all over the community, right? Tell us some things that your team is doing in the community.
So today, our team is, and it's not just our team, it's the team and the community.
Yes.
So because it's about partnerships, it's not just one team that's going to improve the health of our community. It is relationships. So today, our team is out helping deliver food boxes and doing the food distribution with a local organization here. And later on today, we're going to be in the community working with another team to provide access. So our overall goal is to try to be everywhere, not so much to be in the spotlight, but to be walking alongside those who are doing the most important work for our communities.
Awesome. Now, Dr. Jackson, how would someone get, your support when you're talking about, these community things that are taking place? How does someone contact you to, get the support of ECU Health?
So one, they can contact me via email, and I will definitely provide that.
Okay.
We have my direct email, and we have a department email. But there are many in the community that fortunately have our contact information. So a phone call is always the easiest way.
Yeah.
We learned during COVID is if we didn't have relationships, we wouldn't be able to move the needle.
Yes.
So we put our phone numbers out in the community, and people used it, and people called. So if anyone is wanting us to be a part of their events, they can reach out to our department.
Okay.
We have local offices in Greenville or in Pitt County, and throughout our other counties throughout the system. There are amazing teams in those counties as well that's doing great work and trying to address those needs as well. So it's not just our team, it's all of our teams trying to impact healthcare.
Now, Dr. Jackson, have y'all tapped into the artificial intelligence aspect of your job yet?
We have not, but there are some that have.
Yeah.
It is showing up everywhere.
Everywhere.
I was playing on my phone earlier and IE popped up.
Yes.
Or, AI popped up. AI popped up. And I'm thinking, what is this for? But we know that it will be instrumental in the way that we address healthcare in the future.
Yes.
It may not be an area that we're focusing in right now in my department, but there are other areas that are going to use this and to impact the way that we deliver care.
Awesome. Dr. Jackson, thank you so much for sitting down, even having this great cup of coffee together. Of course, I like to give a toast to you and all that you're doing here in our community, because we need more people like you and just a woman of color in general. Literally, when your communications person told me about you and sent me your picture, I got all excited because sometimes not seeing people of color in positions that you have, like vice president and president, you don't feel inspired to, shoot for those goals. But thank you for giving us a voice and being there just to fight for us and, break a lot of barriers that you're doing in your position. So we appreciate you, and thank you for sitting down with me this morning.
Well, I appreciate it. And just one more thing, representation is important. We can't thrive or dream to be something if we don't see ourselves.
Yes.
So it's important that this opportunity is here locally, and that our organization sees that it's important for us to have all voices at the table so that we can address health for all. That's the part of what health equity is all about, that we're addressing health equity for all.
Health equity for all. And on that note, of course, I'm encouraging you to reach out to Dr. Jackson, of course, at ECU Health. She's doing phenomenal things with her team. And of course, at ECU Health in general, you know, a lot of things have changed with their branding, but they're still creating great opportunities for people to be involved and innovative opportunities for better access to healthcare. So I'm super excited about that. And of course, I'm encouraging you to head on over and follow Greenville Public Access Television as well as Bright Books Club TV to make sure that you have access to all of this information ongoingly. Thank you. And of course, go out and make today a great day. Have a blessed one. Peace.